In the year 2000, the newly formed Lemoyne-Owen College Environmental Research and Training Center opened its doors to citizens in the community to work with the health department to conduct lead, mold, and asbestos inspections in older homes and apartment buildings. Several years later, many of those same citizens came together to form the Memphis Shelby County Lead Safe Collaborative, also known as MSCLC. Over the past 2 decades, MSCLC has made significant strides in raising awareness, promoting safety measures, and implementing effective lead abatement programs intended to eliminate further harm to local communities. MSCLC continues to work closely with local health departments, community organizations, and concerned citizens, developing a comprehensive approach to tackling lead contamination in older housing and public buildings. Lead is a heavy metal that has been used in a variety of applications, from plumbing and paint to batteries and radiation shielding. It is a dense, soft, and malleable element that has been used in a variety of applications, from plumbing and paint to batteries and radiation shielding. Over the years, scientists have learned just how toxic this material can be around humans. Exposure to this material can lead to severe health issues, affecting many areas of the body and the nervous system. These findings led to policies demanding significant reductions in its use, especially in household products and gasoline. The ultimate goal was to protect human health and the environment impacted by lead contamination. The Environmental Protection Agency, EPA, set a blood lead level of concern at 3.5 micrograms per deciliter, due to its significant health effects on young children and pregnant women. However, it is critically important to note that any amount of lead in the blood can lead to developmental delays, learning difficulties, and a range of other health issues. 20 years of research in Memphis and Shelby County demonstrated that certain communities have had constant exposure to lead hazards. Studies have shown, during this period of observation, that 90% of children tested were lead exposed. This was largely attributed to a combination of factors, including older housing stock with lead-based paints, proximity to old industrial sites, lead water lines, and lead fixtures inside of these homes. When testing for lead found in apartment dwellings, the assessor will compare the age of the apartment with the number of existing apartments. A chart will indicate a small percentage that must be randomly sampled. Once apartments are selected for testing and they are considered either positively or negatively exposed to lead toxins, a decision must be made as to whether every apartment must be tested and assumed to be positive or negative. Common signs that a person may be lead poisoned include tiredness, sleep problems, dizziness, irritability, nervousness, headaches, difficulty concentrating, depression, forgetfulness, hyperactivity in children, numbness, wrist or foot drop, weakness, clumsiness, joint and muscle pain, vomiting, loss of appetite, stomach aches, constipation, metal taste in the mouth, and problems having healthy children. There are 9 health effects of lead exposure: anemia, high blood pressure, damage to blood cell formation, kidney disease, brain damage, nerve damage, decreased fertility, premature births, miscarriages. It is important to note that you may not know that you have lead poisoning. Second, lead can cause damage without signs or symptoms. Third, lead poisoning is sometimes mistaken for the flu. And last, the health effects of lead poisoning are often difficult to recognize. Acute lead poisoning is the amount set by authorities that classifies a person as lead poisoned which qualifies for medical help. Presently that level is 3 micrograms per deciliter under state regulations and 3.5 micrograms per deciliter per Shelby County Health Department guidelines. Chronic lead poisoning happens from an accumulation of lead stored in various parts of the body like the brain, bones, etc. Body burden is defined as the amount of lead that is stored in the body. Lead can remain in the blood up to 8 weeks. If not excreted, lead can store in the bones, tissues, and various parts of the body for up to 30 years. Hence the need for constant monitoring upon exposure. At age 30, Stephen Hopkins was back in the Army for a second time. After serving as an enlisted soldier from 1991 to 1995, he returned as an officer in 2000. But in 2005, Hopkins began experiencing wild swings in blood pressure. He also had other symptoms: crippling nausea, constant dizziness, a skyrocketing heart rate. He was sent to the Mount Sinai Health System, where it was discovered he had chronic lead poisoning. The Army thought he was faking his health issues. Turns out he really had chronic lead poisoning. A University of Cincinnati study evaluated the effect of lead on the brain, revealing significant findings that highlight the detrimental impact of this toxic metal. The research, conducted over several years, involved both human participants and laboratory models to ensure comprehensive results. It demonstrated that exposure to lead, even at low levels, can lead to cognitive impairments, reduced attention span, and difficulties in learning and memory. Researcher and study investigator Kim Cecil explains how lead tricks the body into thinking it is calcium, hiding in the bones and the brain, where it disrupts the vital signaling between neurons. Lead can impact brain development. Researchers at the University of Cincinnati studied the link between early lead exposure and autism spectrum disorders, ASD, by analyzing environmental and health data. They found that higher lead exposure correlated with increased ASD behaviors and symptoms. The study highlights the need to reduce lead exposure, especially for children, and calls for greater public awareness and policy initiatives to address environmental hazards, thereby protecting vulnerable groups, primarily young children. Biologist Michael Skinner defines transgenerational epidemiology as the study of health conditions and traits transmitted across generations through genetics, epigenetics, and environmental factors. It explores how elements like diet, stress, and toxins affect health in individuals and their descendants. Researchers seek to create strategies to prevent negative health outcomes over generations, aiming for healthier futures for families and communities. Lead exposure and crime have been linked in various studies, suggesting that higher levels of lead exposure during childhood may correlate with increased rates of criminal behavior later in life. Researchers propose that lead's neurotoxic effects can impair cognitive function and self-regulation, leading to difficulties in decision-making and impulse control. This connection has spurred public health initiatives aimed at reducing lead exposure, particularly in vulnerable communities, to foster healthier development and potentially decrease crime rates. Efforts include replacing lead pipes, removing lead-based paints, and ensuring access to clean, safe environments for children to grow and thrive. Neighborhoods in Memphis, Tennessee, where highest crime rates occur, often drawing attention from both local authorities and community organizations, include areas such as Frazier, Whitehaven, and Orangemound. These neighborhoods, while rich in history and culture, continue to face mounting challenges due to economic hardships and exposure to environmental toxins like lead. The Flint water crisis was a public health disaster that began in 2014 when the drinking water source for the city of Flint, Michigan, was switched from Lake Huron to the Flint River. The decision was made as a cost-saving measure, but it resulted in lead contamination and numerous other health issues for the residents. This crisis highlighted significant failures in government oversight and the need for stronger environmental regulations and infrastructure improvements to protect public health. Additionally, infrastructure improvements to replace old pipes and safeguard the community's health still remains a top concern. Though challenges remain, MSCLC and other partnering agencies is committed to providing clean and safe water, putting into practice the experiences of other cities and striving for transparency and active community involvement in water quality management. In recent years, the presence of fluoride in water supply has become a much larger problem than scientists initially thought. Fluoride is often found in dental products and drinking water. While it is beneficial in small amounts as it helps to strengthen enamel and prevent cavities, it turns out that excessive exposure to fluoride can lead to dental and skeletal fluorosis, conditions that cause discoloration and damage to bones and teeth. Understanding the sources and risks of fluoride and lead exposure is crucial for maintaining health and preventing long-term damage. Public health measures, such as monitoring water quality and reducing the use and contact of lead-based products to fluoride, play an essential role in safeguarding communities. The Memphis Lead Elimination Action Plan is a comprehensive initiative designed to address and mitigate the risks associated with lead exposure in the community, particularly focusing on vulnerable populations such as children and pregnant women. This plan involved using a multifaceted approach that includes public awareness and education, testing and screening, remediation and abatement, policy and advocacy, partnerships and collaboration. The Environmental Protection Agency Appreciative Inquiry focused on exploring and enhancing the agency's efforts in promoting sustainable practices and environmental stewardship. By engaging stakeholders from various sectors, the inquiry aimed to identify existing strengths and successful initiatives within the EPA, fostering a collaborative environment to inspire innovative solutions to environmental challenges. Participants were encouraged to share positive experiences and envision a future where the EPA's goals align with broader sustainability objectives, ultimately leading to more effective and meaningful environmental protection strategies. MSCLC and numerous local agencies pushing for increased action for a lead-free Memphis participated in 2 inquiries in recent years. The results of the inquiry's impact were mixed, with more work to be done. For more information about research collected by the Memphis Shelby County Lead Safe Collaborative and other research published throughout the country, please go to gettheleadout.org. There you will be able to access more in-depth studies and detailed articles pertinent to understanding the ongoing challenges the nation and in particular Memphis and Shelby County face in ridding lead contamination from the present-day environment. This presentation is brought to you by the Memphis Shelby County Lead Safe Collaborative.